yeah, g'day Karen, it's Terry and Billy with the live view. Just wondering if you're seeing our pictures. Just got some stuff to send back. Should be a lady in a hospital bed. What's the slope?
Gastro.
Gastro. Okay, recently. I think there's about 15 minutes. So if we do a press conference straight after this with live view too.
Give it an hour just to.
Sure. Okay, bye.
teleconference, we've got Dr. Kevin Sneed, Chief Executive of the Hawke's Bay District Health Board, who's going to just do an update on where we're at the state of play today. And
Dr. Who, sorry?
Kevin Sneed.
Oh, Sneed, yeah, thank you.
And Dr. William Ranger, who's a public health physician who's acting medical officer of health over the weekend, and he's from Auckland.
So good morning, and there's two things we particularly want to comment on today. First is where we are with the outbreak and how the health system is coping, and then secondly we want to talk a little bit about over a period of time about the cases of Campylobacter that we've seen in the community.
Sorry, can I just get you to move over a bit? This line blocking my view.
Okay. In terms of the overall picture, we're seeing, as we saw happening over the last few days, the health situation with regard to Campylobacter coming under control. The numbers of confirmed cases are just slightly up today, 476. Hospitalisations are...
Sorry, confirmed cases 476.
476, so it was 472 yesterday. Confirmed and probable. So we've got 125 confirmed and 351 probable, so that makes a total of 476. And that includes, those are mostly in Havelock North, but there are some cases outside of Havelock North as well. The people in hospital, there are 10 in the general wards, and we have no patients on intensive care. And a patient who was reported on Thursday is not now thought to be related to this event. The hospital itself is green. That means it's under normal pressure. It's got 24 beds available. We've had no presentations to the emergency department overnight. Demand on primary care yesterday was pretty stable and well down from the peaks with 93 visits. St John's and Healthline have seen a falling off of activity, pharmacies, district nursing. So very much the pattern is one of the decline of the demand on services as people begin to recover and as new cases stop appearing. So, as I say, the health system is coping well at present. So that's the main message for today. What I wanted William now to do is just to talk you through some of the investigation that he's been doing, looking at over in recent times, what have we seen in terms of numbers of notifications of Campylobacter, and has there been anything, apart from the current events, has there been anything out of the ordinary in recent times? So perhaps, William, if I could hand over to you.
Yep, thank you. So Campylobacter is a disease that's notified year-round but has seasonal variations, so it's quite often associated with the summer months. Speculated that that's due to people being outdoors and with their food preparation practices. So, across the country and in this district, you'll see more cases in the summertime and less in the wintertime. So, public health authorities track the occurrence of diseases like Campylobacter to see if there are any unusual patterns. So just looking at the patterns in recent times in Hawke's Bay, putting aside August in the last week or so, the numbers in June and July are actually relatively low compared to previous years. The numbers in April and May were slightly higher than the previous year, but comparable to some of the years in the last 10 years. At that time, the Public Health Unit noticed these numbers. To give you a comparison, there were 28 notified cases in April and May, and in the previous year there were 8 and 18 in those months. So it was approximately double, not hugely different. The Public Health Unit followed up to investigate why that might be by talking to cases and seeing what might have been their exposure. There was no common source identified at that time, so there was no particular food source. There was no concern about a common source. So it was thought that these were just in the normal course of events, sporadic cases, but slightly more than the previous year. And it was thought that, if you'll recall, that it was quite a long summer. Winter didn't arrive until quite recently. The hypothesis is that what we saw was just a longer summer period of more cases. So basically, a few more cases in April and May, probably related to the long summer, and then normal or fewer cases in June and July, and then the current event.
Did you look at water in those, and looking at those extra cases, did you look at the water supply and whether that was possibly a problem?
They didn't undertake any environmental sampling. What they were carrying out was epidemiological investigations, so talking to cases about their potential exposures, looking for food or water or any other sort of common source, and water was not apparently a common feature.
So is there any chance it could have been because of water? Is there any way of going back and testing that and seeing if there was a problem with the water at that point?
Most likely not, and I say that on the basis that if it was the water, you would have seen vastly more numbers of people exposed, and you would have had what we've seen in the last few weeks.
Kevin, can we just ask about the family of Jean Sparksman, who's been, his son's been speaking out in the last 24 hours or so. Lawrence Yule has said he will meet with the family to discuss what's happened there. Is that something you will do as Chief Executive of DHB as well?
Obviously, we have great sympathy with the family for the death that occurred. I think you need to recognise that this lady was never attended to by the DHB services, so lies outside of our jurisdiction. I mean, obviously, we are keen that the family understand, and we reach out to the family, and we will be ensuring that some of our medical staff are able to make contact with the family.
Can you make any comment on yesterday's initial DNA test or ESR report that came out?
What on whether it was avian or bovine? I think it's too soon to make any comment on that. It proves nothing one way or the other, really. You have to wait a few days until you have a conclusive specimen. That was a preliminary result.
When you say that there was 476 confirmed cases, do you mean what do you?
So I mean 125 confirmed by testing, and 351 in addition confirmed or probable by the clinical signs and symptoms.
On that, have you?
Right, but what about the other thousands that have been reported? So 4,100.
So those are separately identified through the community survey that was done by phone.
Right.
And that gave us that was a survey on the phone asking a number of questions just to give us an idea of who's been affected, but they've not been rigorously assessed in the same way. But it gives us a good idea of how many people have been affected in the community.
Stephen, there's some sort of talk on Facebook, and there's a lot of talk on Facebook, about chlorination shock, or elderly people particularly who've never had, or very frequently had chlorinated water, experiencing some difficulty or adverse reaction to having chlorine in the water. Is there anything to this?
That's not something I've ever heard of before.
No, not that I'm aware of.
Would people notice the chlorine in the water? I mean, would they notice it when they're showering or bathing or drinking it? You know, would you expect people to perhaps have a reaction to it?
Well, I mean, I've spent most of my life drinking and showering in chlorinated water in the UK, and I've never had a problem with it personally. Most of the developed world has chlorinated water, so it's the norm. It's not unusual to have chlorinated water.
But if
here
you've
it's
gone from
different.
not,
Sure.
if you've gone from not having it and then all of a sudden having it in the water.
I think I'm not aware of any evidence to that effect.
Just on the, you talked yesterday about making health officials aware of the fact that people have secondary symptoms from Campylobacter. Have you had any reports of people suffering from those secondary symptoms?
And William can comment, but we have some cases outside of Havelock North that have not definitively been connected to the outbreak that are presumed to be secondary. William?
I can't add to that. You would expect, you're talking about secondary cases of Campylobacteriosis, yeah?
No, sorry.
You're talking about
Guillain-Barré syndrome.
complications.
Sorry, complications. Sorry, I think that's secondary. Sorry, I'm misunderstanding. So, in terms of the secondary complications, I'm not aware of. I'm not aware of any problems with. I think we're going to have to turn that off. I'm not aware of any problems with secondary complications so far.
And again, can you just give us the sort of thing that people should be looking out for and what your message is to those people?
There are two issues particularly that we commented on yesterday. One is to do with, both are pretty unusual. The more common one is to do with an arthritis, which if you start getting any pain in the joints, that you should contact your general practitioner. The arthritis that's associated with Campylobacter is, again, pretty unusual, but is self-limiting and treatable in primary care. The very, very rare symptom that Guillain-Barré is people should be contacting their general practitioner if they start having weakness and numbness, particularly in the feet and hands, and should be in contact with the general practitioner at an early stage.
And have you asked general practitioners and others to report any of that that people present?
So information is going out to general practice, and also we've made sure that staff in the hospital have been trained to recognise symptoms. I mean, I think it's being vigilant, and if there's any doubt, referring, contacting your GP, and if general practitioner is concerned, referring to the hospital.
Is it not true that there's actually somebody in the Hastings Hospital at the moment that's a Havelock North resident that was affected by Campylobacter a couple of months ago that does have that neurological condition?
So
on John Campbell's show yesterday.
Yeah, so we don't normally comment on individuals. However, I mean, I think in this individual's case, and she's put it out there really that she has a condition and it's said to be associated with Campylobacter. I'm unsure at this stage whether there's a definitive diagnosis in this case, and I understand that the lady is improving and is really keen to raise awareness of the condition and is keen to put her symptoms out there so that people can have a better understanding of what to look out for, which I'm grateful for. But it's pretty clear that the Campylobacter that we're talking about in this case is not related to the current outbreak.
Are you concerned at all that there may still people be out there in homes who haven't perhaps got the medical care they need, who can't because they've been sick, that they're still needing help?
We've done a lot of work reaching out, making contact, phoning, knocking on doors. I'd be surprised if there were people out there that were sick that we were not in contact with now. So I don't believe that's the case, and obviously we've done everything that we can to make sure that's not the case.
And are you going to do another one of the ring arounds to find out cases? Was that finished now? That check?
William, are we doing another one?
No, I don't know about that.
I think that there was an intention to do some more work on that, but at this stage we may do some further work on that.
So you're keeping it at that 4,100 number for now?
The 4,000, we're keeping it at that for now, and we'll review whether we need to do that in over the next week. I mean, obviously we'll be trying to make contact as we explore the nature of the outbreak and seek further information as time goes on, so people can expect to have some further surveys done over the next number of days.
Does that 4,100 include the cases outside of Havelock North, like in Hastings?
So that was specifically focused on the Havelock North cases.
So how many are outside of Havelock North?
Do you know the answer to that?
No.
I think I think it's around in terms of the 476 that we have. It's around 100 or so of the cases of the 476 are in Hastings or outside of Havelock North. So it's about 20-25% of those cases.
From a health perspective, do you think the water in Hastings should continue to be chlorinated?
What you mean permanently?
No, but for the foreseeable future.
For the foreseeable future, I think for the foreseeable future they should be chlorinated, and I think that then it's a matter of judgment in when all this is settled down in the cold light of day, about when we take the chlorination out.
What about permanently?
Well, again, that's not a matter for me to decide.
Where to from here then for the health board? What are you doing in the next couple of days?
Well, next couple of days, we think that the number of cases are declining, the pressure eases, and we anticipate that we really expect to get back down to business as usual over the next week.
Do you think people should continue boiling the water for now?
They need to continue boiling the water for now. I think we're hopeful that over the course of the next week we'll be able to sort out the water supply so that and the council can tell you more about this, so that we're sourcing all of the water from the Hastings bores. At that point, there's no need to boil the water.
If I could just add to that, just from a public health perspective, we touched slightly on secondary cases, so I think it's really important that people keep up their hand hygiene and food preparation so that we prevent people who have got Campylobacter passing it on and getting more secondary cases. But one of the things that will be continuing will be enhanced surveillance of notifications to understand the situation as best we can.
Does that mean are you happy? I see that there are school sports being played today. There was some talk of those being cancelled. Are you happy for schools to go back on Monday, or are you still concerned about that?
I think with the right attention to hand hygiene and personal hygiene, then I think we're happy with that.
Can parents be confident, particularly with young kids, that there is the right hygiene practices in place and that kind of thing to stop the spreading?
Well, I think if institutions, I think we can be relatively confident that institutions, early childhood education centres and schools are well versed in hygiene and certainly will have a high awareness with current events, and I would hope that parents likewise would be paying attention to the messaging around hand hygiene in particular.
Importantly, also remember that it's really important that people don't come back for 48 hours until the symptoms have disappeared for 48 hours. So we don't want people coming back too soon. That introduces a risk.
Kevin, can I just ask, there's been a lot of discussion in the last 24 hours or so about declaring a drinking water emergency. What are your thoughts along those lines? Is it past the time for that now, would you say?
I'd say so. I mean, it looks to me like it's becoming well under control now, and as it has been for several days. I mean, I think the most important, if you look at the epidemic curve that we showed you yesterday, it's quite clear that the most important intervention was chlorinating the water, and from the chlorination of the water, you've seen the decline in cases. So the fact that that was done on Friday has had the biggest impact, and then it's really been a matter of coping with the disease in our community. And as I said before, I think the health service has done a fantastic job in coping with that, and the community's really rallied together. And now it's more, for me, a matter of getting the community back on its feet, the welfare, the support that the council can give and others, and for the health service, really it's a matter of getting back on and doing the kind of great work that the health service always does to treat patients as business as usual.
Okay, guys, any more questions? Just one thing I just want to clarify from Kevin. He said that there'd be no ED presentations. That was just people with diarrhoea and vomiting.
Yeah, so yeah, there are other reasons why people come to our emergency department.
Okay, so next, Ross McLeod, who's the Chief Executive, and who you've been seeing through the week.
Natasha, we've just got Ross McLeod, who's the District Council Chief Executive.
You go on this side.
Good morning. Just a couple of announcements to make this morning, and I'll ask Brett to start with the latest water testing results.
So in terms of the latest results, we've received the results back from the Havelock North supply, so the reticulation has come back clear again, so it's been clear since last Saturday. Bore 2 is clear, however Bore 1 is still showing a low level of contamination, and we're seeing now just this fluctuation between sometimes the bores are showing positive results, sometimes they're not, and the level of contamination is very low now. So it just shows that the chlorination has been highly effective at containing the outbreak since Saturday last week.
Can you, do you want to, before we ask questions, do you want to?
Yes, just another announcement, or a couple of announcements. The welfare operation is continuing. We have staff in Havelock North over the weekend working with people that need assistance, staff in the Red Cross and that welfare operation. I think we released news yesterday that the water tankers have been removed and are being re-sterilised, filled and tested before they're put back in the field for the schools on Monday, so the schools can open with, and that water will be chlorinated as well. We are working with businesses in Havelock North and providing some bottled type water to businesses for food preparation and coffee machines and things like that. So part of that, working with, seeing how we can help people to try and get that business community back on its feet and trying to provide confidence to people that Havelock North is open for business. And I think that's probably the main issues that we have.
Can we talk about yesterday's, the test that came out last night? From your point of view, what does that say?
This is the Campylobacter report. Sorry. So the Campylobacter report is an interim report, and we've been advised that we will receive a further report early next week. In discussion with that report, it's a very technical report, so I think our take out of that, without the experts explaining exactly what it means, is that it's more likely to be bovine in nature, so sheep, cattle, deer. However, it doesn't completely rule out avian. It says it's unlikely. But our take out of that report means that we can't discount any source within the catchment at this stage, so it doesn't rule out anything.
Is that frustrating for you and for people then? Because that's over a week and really you're not any closer to knowing anything.
Yeah, I guess it just goes to the nature that in terms of trying to understand the nature of bugs, it's very difficult. And when you look at the testing, it takes a long time to get tests, and it would be great if you could just, you could get instant results, but I think that's the frustrating thing, is that you actually have to wait for the cultures to be grown and analysed, and it does take a long time. Yeah.
I think it's quite important that we keep an open mind as to what the source might be, and we're certainly doing quite a bit of work in conjunction with the Hawke's Bay Regional Council on looking at possible sources or possible issues that could be a source or a cause of this. So that work will continue, and there will be quite a bit of science to be done behind that to establish any causal link.
Does that mean it could have come from further afield than initially thought, given you're talking to the regional council as well?
I think we're very interested in the catchment around those bores. There's a groundwater system, there is land around those bores, and that will be the primary source of interest.
So you still think it has come from some of those farms around that area?
We think it's likely to be in the catchment of that area.
What sort of radius of those bores?
We're still trying to determine that. So there are some ways where you can, and I think I talked about it previously, that understanding how long bugs can survive in that sort of environment, and then how the nature of the water travelling through the aquifer means that we can kind of determine an area of influence, because if the bugs can only survive for a certain time, then the travel of water is slow in those aquifers. It just means that it can't come from, anything that's a further distance away from the bore. So we're still trying to calculate that. Lost my train of thought now.
Well, didn't Barry Pyle do a big study on these bores? And it wasn't a 7-day study, the aquifers rather, they're the same aquifers. He covered how far Campylobacter specifically could travel.
I'm not aware of that information. So the regional council are actually looking at trying to determine where that actually area or potential area of contamination is. So the understanding of the aquifer is something that the regional council are versed in. So we're working with them to understand how the aquifer behaves in that area around the bores.
So we think that catchment, we don't know actually how far out from the bores that it could include.
Yeah, I think there's two areas of research. One is, where are the potential sources of contamination that could have got into the bores? And the second one is, how did it get into a secure groundwater? Because it has to find a way from the surface to the aquifer, because there is a 3-metre confining layer between the surface groundwater and then the older groundwater underneath that we draw from. So it has to get from the surface to the aquifer, because for 30 odd years that hasn't happened, and now it has.
Well, it happened in 2013 at the mushroom farm, and that's where that impermeable layer was breached. Is that not still breached?
Sorry, we don't know that it happened in 2013 at the mushroom farm. We know there have been 3 low-level events in bore 3, which was why that was shut. So I just, we can't, we don't have any proof that was associated with.
But the layer was breached.
Well, I think, as I said before, what happened in bore 3 was isolated to bore 3. So when that contamination occurred, the testing that we did in bores 1 and 2, it didn't happen. So it may be that the two types of contaminant events are unrelated. So what happened in 3 didn't happen in 1 and 2, Because if it was the same type of contamination event, then you would expect that it would show up in 1 and 2 as well. But bore 3 was different. The way it behaved, the way it cleared very quickly, would suggest that that event may not have been the same that has caused the contamination in 1 and 2.
Yeah. Mm-hmm.
So has this then, the test that you got last night, has it ruled anything in or out? Or are we in the same position as we were before that?
I think, one, it's an interim test, and there's further work going on the test that will hopefully tell us more. I don't think it has ruled in or anything in or out, but it's certainly expanded our knowledge, and we expect the further testing and results to do that as well. We're trying to assemble a range of information that's going to help us narrow down, hopefully, on a source.
And what do you think of how the council's come under a lot of criticism this week for various ways this has been handled? What do you think? How do you describe the council's handling of this?
I think the council's handling of this has been very professional. I've been working with the sort of specialists who have been dealing with this. We were alerted, as being canvassed quite extensively last Friday. The decision to chlorinate was made in the afternoon. We started working with the District Health Board at that time and through into that evening. We had people, contractors in the field till past midnight on Friday night, dragging water through the system so that we were getting stuff into the system as quickly as possible. We've been, obviously this is an issue that affects people, their health. It affects their confidence in the water supply, which is something everybody takes for granted, and it scares people because their kids are getting sick, and it's a terrible thing. So we've been trying to communicate with people. We've been taking an abundance of caution in the week since, and hence the decision to chlorinate the Hastings supply at the moment. And the team that I'm working with, I'm watching them. They're taking sound professional judgment and steps to manage the situation and make the water supply safe.
If the council's found to be at fault here when the results of the inquiry or whatever happens, as CEO, will you take responsibility for that?
Well, I think as CEO, I'm responsible for everything in the organisation. So I think that is something that remains to be seen in the inquiry. But certainly, we will be a full participant and cooperate in the inquiry. And if there are, certainly there will be probably things we can learn. But yes, I'm responsible for the organisation and how it operates.
Do you think the council is in any way to blame for what's happened?
There is nothing that I have seen yet, and the Mayor has said this, there is nothing I have seen yet that points to human error or technical failings in our systems. The inquiry will canvass those issues. There may be something that is found, but from what we've seen so far, there's something that has changed that has introduced a contaminant into our groundwater. We're not aware of that yet. We have responded to that as quickly as we can when we knew what was happening, and there is the chlorination of the water, the boil water notice, the very precautionary chlorination of the Hastings supply this week, and we're trying to also offer the welfare services and the support to the community where we can to help with the recovery. That work will go on. We will expand our recovery operation next week. We're still also in the response phase, but that work with the community to try and help businesses and people recover from the impacts of this event will go on for some time.
What about the maintenance of those bores? Has anyone looked at the maintenance plan on those and whether that was kept up to date?
I'm advised, and Brett may wish to comment on this further, that everything we are doing in the bores and our wider reticulation and water supply across the district is in line with the New Zealand drinking water standards. Every part of our operation. You may wish to comment on that further, Brett.
Yeah, in terms of the maintenance, we're doing regular maintenance checks, inspections. The systems are linked into a central telemetry system, so we've got lots of eyes and ears out there, and there is nothing there that would indicate that there's been a systematic failure of any of our systems or infrastructure.
When will the chlorine be removed from the Hastings water supply if it is known to be?
At this stage, I think it is prudent to leave the chlorination in the water at this time, and a lot of that is for public confidence. We're in a situation now where a positive presence test, even if it turns out to be negative the next day, that is of concern to people and undermines confidence. So while there is this concern, I think it's prudent for us to leave it in there. I think the longer term issues are a conversation for the community to have. I know this area has always been very keen to keep its clean, pristine aquifer water, and that's something people almost take a lot of pride in here. So there's a longer term conversation for our community around risk versus the absolutely good and pristine water we get here from the ground.
So roughly weeks at least, do you think?
I think over the next few weeks, yes, we'll be continuing to keep the supply chlorinated.
Are there any complaints about that?
We've had very few complaints in Hastings, and it's at normal levels that are dosed anywhere else in the country. So we're targeting anywhere between 0.7 and 1 parts per million. So it's normal chlorination operations that you see elsewhere in the country.
And what's the added cost? Like, what's it costing to chlorinate both systems?
It's very low cost because we're using the systems that usually dose fluoride. We've just taken the fluoride out and put chlorine into the system.
So there's no fluoride in the system?
So there is no fluoride being dosed in the system at the moment.
And either Hastings or Napier?
Napier's.
Napier does.
We can't comment. Yeah.
Hey, either in Hastings or Havelock North. Yeah, there's no
When was that?
So we use the fluoridation dosing system to dose the chlorine. So we can't dose both together. So we've swapped the fluoride out and put the chlorine into the dosing system.
So from Friday in Havelock and from Thursday in Hastings.
Ian, has anyone been down on how much all this has cost so far?
No. We're obviously have good budget management going on, but our first operation has been response. We've got budgets within the water area. Obviously, we're drawing on, and we're providing support. We'll be keeping a track on that as we go forward. But,
and will you make that public?
Certainly, we can do that. Yes. There's no our finances are an open book.
What's council absenteeism been like?
We've had some staff affected by the illness. Obviously, we live in this community, and we've have staff affected. I just don't have the exact numbers yet, but we've had a noticeable staff. I think we have 100 of our staff live in Havelock North out of about 400. So a number of them have been affected, probably in line with the proportion of the community.
Okay, guys. Anything else pressing?
There is one thing. In terms of compensation, let's not use that word, but just the cost to those people. Like many of us who live up there have been able to continue to work, but it's meant the other half have had to stay at home looking after the kids. There has been a really big cost, not just to the businesses, but to that whole community. Is that going to be addressed at any stage by the council?
I certainly think that's something that the council will want to look at. We don't have a view on that yet, and there's also, I'm aware that the government is also looking at the ways that it can assist, and have done some things already So those are issues to be worked on as we go forward. As I said before, our welfare sort of focus will be, and recovery focus will be expanding, and those are the sorts of issues that will come under that sort of head. The focus, the main focus on, obviously over the past week has been in response and making sure the water is safe.
What could you do? I mean, how can you compensate people for that?
I probably don't want to comment on the detail at this stage. We'll have people look at the things that we can do. The ministers that have been here have said they're going to look at the things that the government might do. So that's still, that's a issue still needs work done on it.
Thanks, people.